Okay, welcome to the next case. So the following is going to be a two-part case. The first part you'll be provided the case stem, in which we'll do the acute resuscitation, and then there'll be a second part where there'll be a communication part. The first part is as follows. Uh, you are caring for a child that has been admitted to a hospital post-operatively for a septic joint washout. This is a 5-year-old child. The patient was just given and ordered their antibiotics, and you're called urgently by the nurse to the bedside because of swelling to the periorbital area in lips. You'll have 1 minute to prepare and think before we begin the case. After the management, we will again move to part two, where we will move to the communication phase. So you can begin your preparation phase at this point now.
Yep, thank you.
Are you ready to proceed?
Yep.
Okay. So I will be a nurse to help you out in this situation. Um, please proceed.
Okay. Hey everyone, I've just been called to this scene. Um, can you tell me what's going on?
Yeah, I've been caring for little Karen here. She was just admitted here for the management of a septic arthritis. They just finished the washout. I was just giving a dose of Ancef to the patient. Oh, sorry, actually, I think it was. I'm not sure. I gave a medicine to the patient, and afterwards, it just immediately just swelled up in a rash.
Okay. So I just want to go ahead and assess the patient right now. Uh,
Sure.
Nurse, are we able to get him onto monitors and get a set of vitals? And then
Yeah,
I'm just going to assess, do a primary survey.
sure.
And so is the airway patent? Is the patient
Uh,
responding?
yes, the patient is has some like swollen lips that you can see overall.
Is there swelling of the lips and or the tongue?
You can see a bit of some swelling to the lips of the tongue. If you want to see, you can proceed to slide 5 to see the swelling.
Okay. Okay. And breathing?
They are working hard to breathe. You can see their work of breathing on slide number 6.
Okay. And on auscultation?
In auscultation, you can hear some wheezing bilaterally.
Okay. Nurse, are we able to please start some oxygen by a non-rebreather
Yes.
and then
Once
circulation?
so the cap refill time is normal overall.
Okay. And heart sounds are normal.
Yes.
Okay. And as far as pupils and the glucose?
Pupils are equal and reactive. Glucose is 6.5. Patient is alert and oriented. Looks like their GCS is 15.
Perfect. And then checking the rest of the body on the skin, do I see any other
Uh,
stigmata?
as you can see on slide number 1, there are a number slide number 5, sorry, there are a number of hives that you can see.
Okay. Perfect. And going back to the vitals that we have right now, so this patient is currently hypotensive, is desaturating down to 92, and is tachypneic as well. So to summarize what we're seeing, everyone in the room, I think we're going to work this up as anaphylactic shock, secondary to the antibiotics that were given. Do we have IV access at the moment?
Yeah, we have one IV access that we
On
use.
IV. Okay. So what I would like done is I would like one 0.2 milligram dose of the 1 milligram per mil concentration of epinephrine given IM into the right anterolateral thigh. And I would like 400 cc's of normal saline given as a push bolus. And then if we can start the patient on a Ventolin neb of 5 milligrams.
And Ventolin neb of 5 milligrams. Okay, I'm gonna take a few seconds just to draw that up. So,
Sure. In the meantime, do we have anybody else available?
uh,
Can we?
I can go through the chart and sort of see. It looks like the patient has a known allergy to penicillin. Um,
Mm-hmm.
it looks like I was just double checking the chart. It looks like, yeah, we were supposed to give Clinda, but it looks like penicillin was given instead.
Okay.
Otherwise, I'm just going through the chart. It looks like she's otherwise been healthy. There's been no other concerns. The surgery was uncomplicated overall. Um,
Okay.
yeah, and she had a
Any other medications?
she had a septic knee that was
Mm-hmm.
no other medication. She looks like she got a dose of some morphine earlier as well too, but that was a couple hours ago. And yeah, it was supposed to be clindamycin given.
Okay.
Okay.
And any other medical conditions?
When I'm looking through the chart, I don't think I see anything else there. No.
Okay. If we have another hand available, are we able to get a second IV on the patient?
Yep, I can get another second IV. I do have the other medications ready to go as well too.
Okay. So
Uh,
let's give the IM epi first.
okay, so I'm going to give 1 milligram per mil of 0.01 milligrams per kilogram of epi. Did we get a weight on the patient?
We did not. I didn't verbalize this, but I'm assuming that as the patient is 5 years old, I'm going off a presumed weight of 20 kilograms. But do we have an accurate weight on the patient?
Yeah, I can get a Brazo tape if you want. But let me check the chart as well too. Um, yeah, it actually does look like they're 20 kilograms, so that works well.
Perfect.
Perfect. So I'll go ahead and I'll be giving point 2 milligrams of the epinephrine as ordered. So I'll be giving it now.
Perfect.
Okay. So medication is delivered.
Okay. And then can we give the bolus, so 400 cc's, and then can we also um, start the Ventolin neb?
Okay, perfect. So we're given the
And
Ventolin.
I'd like to reassess my ABCs now and my vitals.
Yep. So after giving Ventolin, your oxygen saturation has improved. Your blood pressure has improved as well. The heart rate remains elevated otherwise, and the work of breathing has decreased.
Okay. And airway, am I seeing um, any reduction in the swelling or any progression?
Swelling looks mildly decreased, but it's still present.
Okay.
Air
And is there any
entering,
stridor?
no stridor that you can hear. It looks like the work of breathing has improved. The wheezing has resolved a bit better, and the cap refill is a bit more brisk at this point.
Okay. So I'm going to wait uh, 4 minutes before giving another epi if things were to worsen. In the meantime, can I get a 20 milligram dose of methylprednisone
Okay,
IV?
methylprednisone. Okay. Okay, I will go get that ready.
Perfect.
So that is ready. I can give that to you now.
Perfect. Yeah, let's go ahead and give that through the IV.
Okay. So 5 minutes have passed at this point.
Mm-hmm.
The heart rate has come down, the oxygen saturation has improved, and the blood pressure has improved. You can see that the swelling has resolved substantially. There's no further airway concerns at this point. So that is the end of part one of this case. We are going to now be transitioning to part two. So the stem for part two is as follows. At this point, the patient has been resuscitated, and the parent is now presenting to you guys. They're wondering if they can find out what happened to this patient, and wondering if there can be an explanation provided to this patient's family.
Sure.
For the second part, I will be stepping into the role of the parent
Okay.
overall.
Can
So
you
you have
remind me of the patient's name, please?
the patient's name is Karen. Uh, I will give you 1 minute to prepare for that.
Mm-hmm.
All right. 1 minute is up. Are
Mm-hmm.
you ready to proceed?
Yep.
Okay. Please begin.
Yeah. Hi there. My name is Dr. Lerner. Uh, are you Karen's parent?
Yes, I am. Yeah, I'm just so worried about what happened. Like, it seems like she had like an allergic reaction. What happened?
Yeah. No, you're absolutely right. There was an allergic reaction. Just before we kind of get into what exactly happened, I just want to find out, like, what do you know of the situation so far?
Yeah, I mean, it's been a bit of a rough go. We've had to wait for a lot of hours to get this operation done. We were in the emergency department. Um, yeah, she had this infected knee. We just drained it. The surgeon said it went well, and then she just needed to stay for a few days of antibiotics. And then yeah, she's been just it's been rough for her overall. I stepped out for a few minutes just to go to the cafeteria, and then I found all this happened right afterwards. So like this is kind of like we're a bit frustrated. We don't know what's happening. We think it's an allergy. Like what happened?
Yeah, yeah. And, this it all sounds very stressful baseline, kind of coming into the hospital for that septic knee, and then to have this happen as well. Like, it sounds very, very stressful, and I can empathize with you on, what you must be going through and the frustration that you're feeling. And so I'm going to do my best to really answer any questions that you have.
Yeah.
What happened today was that, uh, as you mentioned, she had an allergic reaction and a severe one that we call anaphylaxis.
Oh my
Has
God.
Karen ever had anaphylaxis before?
Yeah, yeah, she's had it.
Yeah.
She has the allergies to nuts before. We have a known penicillin allergy. We told that at presentation. Yeah,
Yeah.
yeah.
Yeah. And so, yeah, so you know how scary that is. And so, the good thing is we have treated the anaphylaxis, and currently she is stable. We will be monitoring her to
Mhm.
just watch out for any, to ensure she's stable, but also to make sure there's no rebound symptoms. Um, as far as how this happened
Yeah.
at this
Like,
moment,
what did she react to? Like,
yeah.
what
So
happened?
it's unclear at this moment exactly what happened. I do know that she was given an antibiotic that does contain penicillin, and so it's
Oh my
likely
God.
that it
Yeah.
was from that.
Okay.
And I do know that it is listed on the chart as one of the items that she's allergic to. Um, as far as how this came to be and how this happened, I'm not sure at the moment, but I assure you that we will investigate this fully to find out how this happened.
My God. Yeah, please. I mean, this is important for us. Like we said it that like she's got a penicillin allergy. Like we need she shouldn't be given. I don't know how this like this error shouldn't have happened, right? Yeah, this is the last thing we needed. Like
Yeah, no, absolutely. Absolutely. And I'm sorry that this has happened. Um, but we will do everything in our power to investigate this thoroughly to make sure we find out how this came to be, and then to make sure that this doesn't happen again in the future.
yes, I think that's yeah, that's really important. So is there anything else that needs to happen now? Like will this affect how long this she stays? Is this gonna make this her stay longer? Is she in pain? Like what else? What's gonna happen to her now?
Yeah, those are great questions. So we're going to continue to monitor her. She's going to need to stay in hospital for a few more hours, at least a minimum of about 6 to 8 hours, I'd say. And we'll just monitor her for any symptoms or signs of anaphylaxis. Um, and then also just make sure that she is stable and doing well from a recovery standpoint from her surgery as well. And then we can talk about next steps once we're at that point. But that's going to be our immediate priority, just to make sure that she remains stable.
Okay. Thank you for letting us know. Yeah, can we just make sure that there's some sort of signage or something that just said that she's got this allergy? Like the last thing is we need another allergic reaction. Like, yeah, like keep
Absolutely.
all the
Yeah.
peanuts away. Like something that's can we put that up? Like no peanuts, no penicillins in the room, and this cannot happen again. Is there someone I
Yeah.
can
No.
contact in the hospital to advance this if
Yeah.
I need to?
Yeah. So I can give you the number of one of our administrators who handles these types of concerns,
Okay.
and that's involved in potential medical errors. And then also, I'm going to go back and ensure that we have the proper signage in place to make sure that everyone is aware of her
Okay.
allergies.
All right. Thank you very much. Thank you for helping her.
No worries, my pleasure.